we have the next speakers. Dr. Asseel Khalaf, Assistant Professor in the Radiology Sciences at Kuwait University. She earned a bachelor's degree in Diagnostic Radiographic Technology and a master's degree in Physiology and a PhD in Gastroenterology at the University of Nottingham. It is my pleasure to introduce my friend, Dr. Asseel, to the stage.
Assalamu alaikum. Good morning. AI has been a big topic of discussion in the last 2 days. So I decided to talk about a recent study done by our lovely team, and I think some of them are already here. But it's not working. Okay. But first, of course, we will have some background introduction about AI itself. Then we will move to the aims, methodology, results, and I will end with some recommendations. I would like to mention that this work has been accepted for publication recently, actually a few weeks ago, in Health Science Reports under this title. No, okay, sorry. Okay, under this title, and this work has been done with my great team. So let's start with some background about AI. So AI is the use of algorithms and models to perform tasks that usually requires a human intelligence. While we're talking about AI in medical imaging, we can use it to analyze, process medical imaging, and it can help us to have a better diagnosis, treatment plannings, and outcomes. There are many applications of AI in medical imaging. Like we can use it for image analysis, image segmentation, image enhancement, and we can do analytics. What are the benefits of AI for us as radiographers? It can improve our workflow efficiency. So AI can help you doing the repetitive work, and in this way you can focus on the patient and patient interaction. And it can enhance image quality by removing image artifacts. There is a rise of AI in medical imaging, and we saw this already. AI has the potential to reshape medical imaging. It can offer faster, accurate, and efficient healthcare services. And it can address the challenges we have. So for example, in Kuwait, we have the long wait time, patient overload, and the shortage of staff. There are many examples of AI. For example, we have the automated fracture detection in X-rays. Like here you have the images. These images, you can see that AI can detect the fractures in the X-rays. Also, you can have a heat map as well. AI can help you in cancer detection, like in MAMU. We can use it in MRI image reconstruction with accelerated scan time. So you can reduce the time required in MRI. Okay, there are many platforms, and I'm sure in the hospitals in Kuwait we have them already. And I will talk about one of them, which is Siemens Healthineers. مدعاية, but because we use it already in the research. So, moving to the research itself, what we did in this study, the aims were to look at the integration of AI in Kuwait, focusing on radiographers' knowledge, perception, and expectations. And also we looked at the evaluation of one of the AI-based software, which is the Siemens software. So what we did in this study, we had two different parts. One of them was the questionnaire-based survey, and the second part was the AI-generated chest reports using the Siemens software. In the first part, we had 50 participants, and in the second part, we took 40 chest X-rays from back system from 3 different hospitals, And we used Siemens AI RAD companion software. And also we asked radiologists to report the quality and accuracy of these generated AI reports. So these figures show you the demographics. Maybe some of you already participated in this study. As you can see in the gender, we have like half males and half females, and most of them were between 26 to 33 with more than 10 years of experience. Okay, moving to the results of the study, I will talk about the results with the figures. The first one is familiarity with AI. I would like to mention that we had different sections. We had almost 6 sections in the figures. The first one was, of course, the demographics. Then we had a baseline question, baseline understanding of AI. Then moving to these different parts. The first one was familiarity with AI. So we had many questions. These are some examples. For example, would you describe yourself as someone who enjoys technology? Would you feel comfortable explaining what an AI algorithm is, and so on? And you can see the different responses from strongly disagree to strongly agree in the green side. And most radiographers agreed that they must adapt and embrace AI technology. And the second one is the opinions on AI. And you can see this in the middle, the famous statement, AI is going to replace radiographers. And I was happy that most of the participants disagreed with the statement. 84% disagreed that AI will replace radiographers. And majority believe that AI can improve actually our job. Looking at the education, most of the participants didn't receive any training, any education about AI, but they showed interest in taking education and in learning about AI itself, so 92% of them. And also we did correlation with all different aspects of the study, and the participants' opinion on AI correlated significantly with the education. This is the only one. The last one was the future roles. Is AI going to affect our future role? And most of the radiographers, the participants, reported that it will definitely affect our future roles. Moving to the next part of the study, we used the software. This is actually a screenshot of the reports generated by AI. You can see the chest report with the pathology indicated, with an AI confidence score from 1 to 10. And I have a video about the software itself. Inshallah يشتغل.
The evaluation of AI RAD Companion provides a brief overview of the 5 most important pathologies.
Der 5 wichtigsten Pathologien.
These include pneumothorax, consolidations, atelectasis, as well as pulmonary lesions and pleural effusions.
Ergüsse innerhalb von 3.
Within 3 minutes, the AI solution sends the annotated image to the colleague who requested the diagnosis.
Diese Befunde beauftragt hat.
The findings are not only shown and highlighted in the images, but are also assigned a confidence score between 1 and 10. The higher the value, the more certain the software is that it is really a finding that matches one of the pathologies.
As a non-radiologist in the emergency room, I have to quickly review and assess many different diagnoses, especially with chest x-rays. It is initially difficult to recognize pathologies, and the AI helps me to review certain areas of the chest x-ray and focus my attention there.
So this is the software we used in the study. And what we did after this is we asked one of the radiologists to report the accuracy of the AI reports, the output. And these are the results from the radiologist. You can see that he agreed with 53% of the reports with no changes required. And let's move to the summary. Yeah, so he agreed with most of them, with 20% requiring minor changes. It's worth mentioning that the reports generated within seconds, which is really important, mainly in if you have it will improve your workflow in the emergency department and in daily requests. Also, I would like to mention the employment request. We usually ask the patient to come the next day to collect the reports. In this way, you can give them the reports in the same day. And again, we always mention this, that AI is not here to replace anyone. It will assist everybody. So this is a third part of the study, but it's not in the paper already. Why? Because we couldn't finish the study. We had only few participants. So the idea was to look at the slice positions and alignments in MRI using AI. So the participant underwent brain MRI scans, okay, using manual, auto, and AI auto-aligned scans. And we recorded the time required. We had only 4 participants with 2 different operators. We wanted to look at the time required and if there is any difference between the operators also who's doing the MRI. Why we did this? Because if you look at the literature, you will see that using the MRI auto-aligned, it can improve the overall image quality and offering a better or accurate diagnosis, mainly in the patient with follow-up, the patient that comes for a regular MRI scans. So it's really important, but we couldn't finish it. This is only the result from 4 participants. You can see the time, we recorded the time, auto, manual, and the auto-align. With auto-aligned, you need only just to click, so you need only a second to click on it, and that's it. And you can see the different operators here. You have operator 1 and operator 2. And again, there is a difference in the time. So AI can speed up MRI scans, which is really important in MRI, which can reduce the waiting time and the patient list. Okay, so what are the messages from this? Radiographers in Kuwait are embracing actually the AI, and there is a significant awareness of AI in Kuwait in medical imaging. AI tools have the potential to reshape and transform medical imaging by enhancing accuracy, streamlining the workflow, and improving the patient care. We have a gap in education and training for radiographers as well as for radiologists. Okay, the main concerns. Will AI replace radiographers? What do you think? No? AI is a tool, not a replacement. And I always say that humans need humans. So it will not replace anyone. Can we trust the AI? Try. No? Okay, tools are available to assist us, but we need the mediators in the middle. The main issue with AI is the ethical consideration. Okay? So because of the black box nature of AI models, we have an issues with data ownership, privacy. So, for example, who is responsible for these reports if it's done by AI? Who is responsible for the image artifacts from the AI? So we need a clear guidelines and ethical frameworks, and we need a human oversight, of course. We are one team, radiologists, radiographers. We share the same goal, to have an accurate diagnosis and exceptional patient care. So AI here to help us to enhance imaging protocols, improve image quality and efficiency, and to have a better workload distribution. AI empowers the entire imaging team to have a better patient outcomes. So how can we move forward from this? Definitely we need research, more research about AI in Kuwait. So continued research, industry collaboration between us, uni, ministry, AI developers. كلنا لازم نشتغل مع بعض. We need data. We need data, AI needs data to be trained. And of course we need to invest in education and training. Talking about education, for radiographers, we need education and training in different parts. Foundational understanding of AI's principles. They need to know about the available AI tools. They need to understand the ethical implications of using AI. And we need hands-on training as well. So, do you think AI is coming? Shaikum? Yes? No? AI is not coming, AI is here already. And it's our choice to resist the change or shape the future together. So my advice is to adapt, learn, and lead this transformation together. And final thought, AI is not here to replace anyone, not here to replace radiographers, but to empower them, enhancing their capability for improved healthcare outcomes. And thank you.